Welcome to NatRevMD, a podcast where we share tips on optimizing medical billing and improving practice efficiency so you can have the business of your dreams. I'm your host, Dr. Heather Signorelli, founder of NatRevMD. Let's get started. All right, so whether you've implemented RPM or you haven't, and you're still trying to figure out ways to capture additional revenue in your practice, today we're going to talk about key areas in 2026 that are going to help you add revenue to your practice. We're going to talk high level in this podcast. We're going to deep dive into one of these strategies in our next podcast, but hopefully these are ways for you to basically just think of additional ways to increase revenue, which is hard today, right? Obviously, hopefully you have been working to get your payer contracts renegotiated every 2 to 3 years. You're making sure that your AR is good. You're working on patient collections, right? You're fixing denials, you're increasing eligibility. All of those things impact it. But today we're going to be talking about, some of the services you can provide or the bills you can drop for things that you're probably already doing. So the 2026 physician fee schedule, isn't just a place for a list of codes. It also is a place for you to kind of dig deep and understand what could you be adding to your practice that either increased or added codes. So we're going to talk about a few of those today. So if you listen to our podcast recently, we talked about remote patient monitoring. Obviously, you guys know if you haven't listened to that podcast, go check it out. It was a couple podcasts ago. But basically for 2020, AMA introduced 5 new codes for shorter duration of remote monitoring. Things like covering 2 to 15-day periods instead of 30, which is a huge opportunity for revenue for our post-op patients, those with acute exacerbations, or just those patients with significant medication change that you need to monitor while you're at home. So basically what changed is you no longer need a full 16 days of data in a 30-day period. You can have those shorter periods. Obviously, this is something that does take time to implement, but the math does make sense for a lot of practices. We have a few who do that already. And so really important to check out that podcast, check out our blog on this. There are some new codes that allow you also to bill for remote patient monitoring just after 10 minutes of service per calendar month, down from the previous years, which require 20-minute threshold. So obviously game changer, obviously something that is worth capturing that revenue. I guarantee you and your team are already answering the messages. You're already answering the phone calls. You're already dealing with patient portal stuff. So the work is being done. You just have to operationalize it, right? And I know that that takes time and energy, but for practices who have an office manager, or maybe you have a front desk lead, this is a perfect place for them to work with a clinical MA or an RN in your practice to operationalize this. So head on over, check that podcast out if you haven't already. All right, so tip number 2, the care management trifecta. So this is the CCM, PCM, and TCM types of services. And so again, this is something that if you're not already offering kind of that full suite of care management services, you are leaving revenue off your practice, right? So 2026, CMS actually handed us a gift, which is rare, right? So they increased reimbursement 10% across all CCM codes. So that's your chronic care management codes. And it doesn't just stop there. So let's kind of go over each of these. So for chronic care management, right, that's that CCM. That's those patients with 2 or more chronic conditions. They had a rate increase. So again, just to a high level on these codes, you've got a 99490, which means 20 minutes of clinical staff time per month, which reimburses around $60, $65, 99439, which is an add-on code for additional 20 minutes, which reimburses additional $50, 99487, which is for those complex CCM, where it's 60 minutes of clinical staff time, which reimburses close to $150. Then we've got principal care management. This is for your patients with one serious chronic condition, so COPD, CHF, cancer, etc. And so you've got a couple different codes. I'm not going to go to these in detail. We could do a whole podcast on that, and maybe I should. But just another thing for you to look up, implementing in your practice. And then the last one is that transitional care management, right? TCM. For patients post-discharge, you have 2 codes based on complexity, that 99495, so that moderate complexity, which does require a face-to-face visit within 14 days. But again, if these patients are coming out of the hospital, you're going to want to see them anyway. So it's just capturing that work and billing for it differently. And then the 99496, which is that high complexity requiring a face-to-face visit within 7 days, which reimbursement can get, close to the $200, $250 per bill for. So again, imagine you have 500 Medicare patients, you enroll just 100 of them in basic CCM, that could be an additional $70,000, $80,000 a year. And that's before you even add in PCM or TCM. So I really, really want to encourage you, if you haven't already looked into these programs, especially if you're a practice that's established, you're growing, or have multiple physicians, maybe you do have time to be in that CEO role, or maybe you're a listener and you run a practice like this, right? So work with your owners, work with your staff in implementing these for a primary care practice. And that can be a wide variety, right? It could be primary care, it could be a subspecialty office, depending on your subspecialty. So I do know how overwhelming all of this can be. So we do have a playbook that we created that just talks about patient AR strategies to make sure you're not losing revenue. Check it out at natrevmd.com/margin-playbook. Check it out, and hopefully it is helpful for you guys. All right, let's look at tip number 3. So this is all about annual wellness visits, so AWV. So this is, again, Medicare program. And, obviously practices want to take advantage of this because it can be a place to increase revenue. And so, again, this is where we've got codes for things like the initial welcome to Medicare visit, which is that GO 402, that first AWV visit for a patient, which is GO 438, and then that subsequent annual wellness visit. So for 2026, there is a new billable service you can add on, which is the GO 136, which is all about social determinants of health, that risk assessment. What's nice is for patients, deductible and coinsurance are waived. So it's a no-brainer for you to add this onto your practice. And the AWV in and of itself can reimburse up to $200. But obviously, the real value is that you identify patients who are good candidates for, again, the CCM, PCM, and RPM. So again, this is a way for you to kind of have a funnel of identifying patients who've got complex needs and then implementing CCM, PCM, or RPM, right? And then TCM for those that are transitioning. So AWV is the start of those conversations so that you can build out those care management programs. Really, really critical for our practices to be thinking outside of the box, especially when some of these have actually increased in revenue, which is a nice bonus. And then tip number 4, last one for this podcast, is all about behavioral health integration, BHI opportunity. So primary care practice has been managing mental health conditions, right, with little to no reimbursement, or you're trying to wrap it up into an E&M. It's just not great. It's not a great system. So in 2026, CMS actually has added in 3 new G codes for behavioral health integration. And these add-on codes, meaning they're billed in addition to other services, specifically with advanced primary care management services, et cetera. So this is actually a way for you to get paid for that integrated behavioral health work you're already doing. And this is going to be the podcast we're going to do a deep dive on, because it is something that, was new to me. We've got some practices who are looking into doing this. Some who are already kind of well into this space. And so want to share kind of tips that we've learned from them, as well as ways for you to bring in additional revenue for work, again, you're already doing. So this is the key for this episode is you're already doing a lot of this work. You just need to make sure that you put in the documentation mechanisms that you're having patients sign, and then, of course, billing for it. You got to drop those codes. So really, really good ways. Again, if you haven't looked up these, all of these are on the CMS website for you to go check out. So bottom line here is you're doing work. Let's make sure you're getting paid for it. So obviously, one of the most important things for all of your patients is a good eligibility process. You have heard me talk about this before, and really want to make sure that if you are seeing a patient, eligibility is done every single time, not once a year, every single visit. So if you are looking for ways to train your front desk staff on eligibility, we have a detailed guide. Head on over to natrevmd.com/eligibility billing verification. So that's eligibility-billing-verification. Again, all of these links are in the show notes, a free checklist to use and help train your front desk on eligibility. So to recap, we talked about RPM. We just kind of gave a high-level summary of RPM as a way to increase revenue. We did a whole podcast on this couple episodes ago. Again, that care management trifecta. So that's your CCM, your PCM, and your TCM. Again, recurring revenue, rates went up. And then, of course, that wellness visit engine that you can use to fuel your care management programs. And then last is that behavioral health integration. So getting paid for that mental health services you're probably already providing. Again, this could be for your OB practice. This could be primary care. This could be many different areas that you are already, again, providing this service. So stop thinking just in terms of, hey, I got the 99213 or obviously part of the program here, but what other things are you already doing that you could get paid for? And then how can you operationalize that? So pick one or two of these, do some research, check out the CMS website. They've got some good, easy to follow program tools that you can use, and just another efficient way to deliver services to your patients. So as always, if you are looking for a full service medical billing and coding team, we are here to help. We'd love to chat with you and help make sure that, you have your billing cycle in the best shape it can be, and that you have a team that helps you kind of operationalize some of these things and really think through, if you've got front desk eligibility, how can we train them? If you've got patient collection issues, what are the ways we can implement? We really do want to work with practices who are ready to kind of make those changes and have the staff and the people to work together on. So head on over to notrevmd.com. We do have a free revenue audit for those who qualify in the top right-hand corner. All right, have a great week.